Even chopping the healthy breasts off one 16-year-old girl is a crime for which someone belongs in prison. So when we're talking thousands.
What happens when you just say to hell with it, I'm going to talk about this issue?
You've got basically no debate, ruin anyone who asks questions.
No, I'm not going anywhere else. Go ahead. It's a free country.
None of this could have happened if there had been free speech.
The Society for Academic Freedom and Scholarship was formed in 1992 and has two goals: protecting freedom of thought in teaching and research, and maintaining academic rigor in universities. On June 10th, 2025, on the University of Ottawa campus, we sat down with Mia Hughes, the author of the WPATH Files, an expose on transgender healthcare. Since publishing the WPATH Files, Mia has been subject to countless attacks from trans activists. Frances Widdowson, Society for Academic Freedom board member and Mount Royal University professor, was wrongfully terminated in part for challenging the dogmas of trans activism. We hope you enjoy this exclusive interview between Frances Widdowson and Mia Hughes, which showcases how trans activism threatens academic freedom and scholarly standards in Canadian institutions.
Okay, so we're here at Tabaret Hall, the University of Ottawa, with the incredible Mia Hughes and her magnificent WPATH Files report. And so I guess what we'll just start, the main thing we want to talk about here is academic freedom, because this filming and everything is being sponsored by the Society for Academic Freedom and Scholarship. And this organization is the foremost academic freedom organization in Canada, protecting the rights of all professors to say what they think is true and to be concerned about academic standards and the lowering of academic standards and so on. But perhaps you should just tell the audience how you fit into this story of trans activism, academic freedom, these kinds of considerations.
Oh, okay. So I discovered the trans issue in 2019. Before that, I was very much minding my own business, homeschooling my children. I was a very uncontroversial person. And then I discovered it on Twitter, and it seemed strange and odd and kind of cartoonish and clownish at first, until I learned what was happening in gender clinics, particularly pediatric gender clinics.
Yes.
As soon as I found out what was happening to adolescents, that they were, chemically castrating them and actually amputating healthy organs, chopping body parts off them, it became a fixation of mine. And with regards to the free speech, academic freedom, in all of the years that I've been researching this, writing about it, speaking about it, I've come to the conclusion that none of this could have happened if there had been free speech and if there had been open debate and discussion, because the reason that people support this medical crime is because they don't really understand that it's happening. They don't really understand the truth of it, and the reason they don't understand the truth of it is because nobody is allowed to talk about it. And so my particular research of late, has focused a lot on the World Professional Association for Transgender Health, WPATH. And, I wrote the WPATH Files. I think WPATH is just part of the bigger picture, though. WPATH does not permit any open debate or discussion. They do not permit any dissent in the same way that nor does any other institution in society.
So this is interesting about the debate aspect. So you made a statement that people are not allowed to dissent, people are not allowed to discuss this matter. How do we know that? Apart from just feeling slightly like we are nervous about it, you can sort of feel the climate about it, but what happens when you just say to hell with it, I'm going to talk about this issue right now? Have you had sort of any kind of ideas about what happens to people when they do talk about this issue?
Oh, well, I mean, there are plenty of high-profile examples. If you stick in the field of medicine, in research in medicine, Lisa Littman is your best example. So around 2014, 2015, gender clinics started to be flooded with a brand new cohort of patients. So pediatric gender clinics would have seen little boys and they would have been very effeminate. Historically, that was hardly any of them. It's very rare, but that would have been the patient cohort.
Yep.
In the mid-2010s, all of a sudden, this explosion of adolescent girls out of nowhere. It's clearly a social contagion, but you need to prove that. You need research. You need to understand what's going on. And so the first person that ever tried to do that was a researcher called Lisa Littman. And she was at Brown University, and she published a paper, famous now, 2018, she published a paper in which she coined the term rapid onset gender dysphoria.
Yep.
And it was just a hypothesis. It was just a paper that had a hypothesis. Look at all these girls, they've come out of nowhere. Like one girl comes out in her class and then a whole cluster of them in the same class. This is a brand new phenomenon. I think they're spending a lot of time online. There's trans influencers online. It looks like peer contagion. I think we should study it.
Yes.
Like we should study it.
Yes,
that was
exactly.
The conclusion.
Yeah.
It wasn't, this is a social contagion. It was, it looks like one. I think we should study it.
Yeah.
And what happened to Lisa Littman sent a clear message to everyone in the field: you are not allowed to talk about this. They viciously destroyed her, basically. First of all, they insisted that the publisher retract the paper. The journal had to retract it, which is not how things are done in academia.
Unless it's fraud or something like that.
Exactly. What should happen is somebody should publish a paper questioning her hypothesis or challenging it. But no, they had the paper, the publisher retract it completely.
Yeah.
And then they went after her job. Yeah. They went after her position at Brown University. They got her ousted. And if I remember correctly, and this is how malicious they are, they wanted to show their dominance, show their power. They insisted that the institution install gender-neutral bathrooms to show their support for the transgender community, because they were suggesting that everything she said was just transphobic. But it wasn't. It was just what any decent epidemiologist would do when you see a brand new phenomenon.
And no conclusion. Like, she wasn't making any conclusions.
It's a hypothesis.
She was just saying, I'm seeing this new thing. This should be a subject of inquiry.
Yeah.
I believe the first academic that I heard that had serious problems was an academic by the name of Michael Bailey, who was at Northwestern. I think he was in American University. And this was in the 90s, so this was the beginnings of it. And he published the book, The Man Who Would Be Queen, which I believe his hypothesis was that men who believe that they're women, so that type of trans, they come in two types. One is the effeminate homosexuals who can't deal with being homosexual and want to change their appearance and everything so they can live a more normal life. And the other is the autogynephiles, which is the men, as far as I understand it, correct me if I'm wrong, men who become sexually aroused by thinking of themselves as a woman, or by thinking that people accept them as a woman. And you mentioned, I believe, the men who are accepted as being part of a women's sewing club or something. Knitting group.
Yeah, so what Mike Bailey did, he was at Northwestern. What Mike Bailey's crime was, so Ray Blanchard had coined the term autogynephilia in 1989, but it stayed in, a very fringe area of sexology. It's not getting any public attention, and it's everyone had long known that most men, the heterosexual men who identify as women, are doing so for erotic purposes. Everyone knew that right from the start. But nobody ever really understood it until Ray Blanchard came up with his theory of autogynephilia, in which they're aroused by the fantasy of having female bodily functions, having female body parts, or being treated as women, being part of a knitting circle. But what Mike Bailey did, he wrote The Man Who Would Be Queen, and it's an excellent book. But he took autogynephilia into the public sphere. He made it into popular culture. And autogynephilic men do not want the world to know what autogynephilia is. Of course, you've got a whole trans rights movement based on this. These men are women because they have female gender identities and they just want to live as their authentic selves. They don't want everyone to know that it's actually a paraphilia and that all these men are aroused by the fantasy of becoming women. So Mike Bailey that's probably the most vicious cancellation ever to have occurred. It went on for years and years. They went after his family. They made up terrible lies about him. But he's still at the university. He did not back down. He did not. He went through hell, and he stood his ground. So,
but the people watching him, though.
It sends a clear message. It sends a clear message.
And that's, I guess, because I sort of knew it was a difficult one, the issue. And it just somehow I just absorbed that idea. I don't know how I just knew that this was going to be a very touchy subject, and I didn't know anything about it, but it was certainly, if you tried to discuss it, you would come under attack, not even taking a position, but just trying to discuss it.
Yeah, I mean, there's Jordan Peterson. I feel like we have to mention Jordan Peterson, what happened to him at the University of Toronto. There were many layers to that. There were many things that had upset people, but what was his pronoun thing? It wasn't even that he said he would not use pronouns.
He said it was, he wouldn't be forced to do it.
Right.
When you were just asked, as a matter of respect, in fact, would you refer to a trans person who asked you to use they, them pronouns, a pronoun which has a several hundred-year historical...
But that's not what we're talking about.
Yes, it is, because it's legislation.
We're saying if it wasn't legislation.
I've got to stop, guys. Look, there's too many of you.
Okay, one simple question.
I've had enough. Sorry, I can't do this.
One simple question.
No, I'm done.
I thought we were statistically irrelevant.
Well, yeah, I mean, like, I don't exist.
And a trans person asked you, would you please refer to me by they and them pronouns? Would you refer to them by those pronouns?
Might depend on how they asked.
So no.
Why do you have the authority to determine whether or not
Why do I have the authority to determine what I say? What kind of question is that?
Why do you have the authority? Let me finish. Why do you have the authority to determine whether or not an individual is worthy of you using their pronouns? Like, if I asked you, would you please use they, them pronouns for me? What?
It would depend on what I thought of your motivation.
Do you want us to jump through?
Those are my pronouns.
It wasn't that he wouldn't, you can't force him to do it. It has to be his choice. And all of those protests and people screaming in his face.
No, that was a bit of a warning cry. And then, of course, there's the Lindsay Shepherd affair that came not too long after that, because she was showing a clip.
Bi-gendered, gender blender, and the list goes on. And Nicholas, this is where I want to bring you into the discussion, because you teach this. You teach trans studies. So if you would, give us a brief primer on so many gender identities that, in your view, require non-traditional pronouns.
Basically, it's not correct that there is such a thing as biological sex.
Jordan Peterson appearing on Television Ontario program about gendered. It was about trans issues, but they had a part where they were talking about gender-neutral pronouns, and she was just using it as an interesting example of how it does matter. Like, this is an issue. It's not just a dry academic thing about whether you use they, them to refer to plural or singular. It caused all this huge uproar, and then she got dragged into a struggle session where people accused her of harming trans students, and there had been a complaint. It was all made up, and it was basically just an attempt to intimidate her. So there was another one that happened on the tail of that other issue, and then now it's just been pretty much silence, with the odd kinds of breakthrough of some kind of controversy.
Yeah, you can understand the silence. It's cowardice, of course, but as well, like, people, they have mortgages, they have families, they're like, and it's not that they're just not touching the issue. It's not that they're supporting it, but they just don't dare go near it. Obviously Robert Wintemute, we must talk about what happened to him. I think McGill deserves credit, first of all. This was, correct me if I'm wrong, I think it was 2022, January 2022, where McGill had invited Professor Robert Wintemute, who is at King's College London. He's a human rights professor. He's a gay man, and he was very prominent in the gay rights movement. He was like on the front lines of the gay rights movement. He was very, very active. And then his story is just fascinating. He was one of the signatories of the Yogyakarta Principles, which was a very pivotal moment in trans activism. It happened in the city of Yogyakarta until 2006. Yep. And it was just basically a bunch of trans activists and human rights lawyers got together and drew up the blueprint of modern trans activism, and he was one of the signatories. And he has since spoken out and said, I regret being a part of that. Yep. Because no one in that room was thinking about the impact it would have on women. Nobody gave a thought to women, and this is like self-ID. This is men can self-ID as women and enter women's spaces, and they can get all the medical body modification that they want on demand as a human right. It's all there in the Yogyakarta Principles. And so he first made himself an enemy of trans activism when he said that. Yep. He said, I regret that, I shouldn't have done it, nobody was thinking about women. Yep. But then what really got the trans activist, he was invited to speak at McGill, and the subject of his talk wasn't Yogyakarta. The subject of his talk was why the LGB should divorce the T. Yeah. And that was too much for Celeste Trianon and the gang of trans activists in Montreal. They organized an enormous protest with, the megaphones and everything, and they're shouting, and they blocked, nobody could get into the lecture theater. Robert himself, I think, made it in, but then they tried to start the lecture with the tiny few number of people who made it through the crowd, and then they burst in and they threw flour all over him, and they were absolutely livid that this, quite frankly, brilliant, kind, decent man was allowed to speak it, because he was suggesting that trans is in conflict with LGB, it's in conflict with gay rights, and basically we need to talk about that. That was the whole point, was let's talk about that. This is why I think this is a university. This is what you're supposed to do in universities. You're supposed to hear ideas that challenge you, that make you think, like diverse opinions, and the Montreal trans activists would not allow it.
Yes, so we have quite a lot of evidence of people not being able to state what they think is true on this. So the free inquiry aspect, which of course is Society for Academic Freedom and Scholarship, SAFS, is one of their major concerns, is what's called prescribed doctrines being imposed, predetermined conclusions, and then institutional censorship, crackdowns on people for various things. And it might not even be you're fired or anything like that. It could just be that, a talk is not allowed to be heard, or that you get punished in some kind of way for doing this. So that's a big issue, which this trans activism really comes up against.
The Society for Academic Freedom and Scholarship is the only organization in Canada that exists specifically to protect the ability of professors to state what they believe to be true. You can support this organization by becoming a member or sending a donation at safs.ca.
But another area that SAFS is very concerned about is academic standards, that the decline in academic standards. And this idea that is at the foundation of trans activism, which we're going to hopefully be talking about a little bit more when we head over to Parliament Hill for the pride flag raising ceremony, is this idea that biological sex is not binary, that male and female, there's more to it than that, and so on, that it's not just about reproductive systems, it's about other multidimensional things. And so we have ideas that don't really make a lot of sense now, that are quite established in the university. And so I was wondering do you have any thoughts? What are some of the largest problems in terms of research having integrity and being able to actually be, as I think is your phrase, be tethered to reality? Like, we become untethered because people can't question things, but what are some of the craziest ideas that we're now plagued with in terms of this area?
Yeah, well, for trans, it's all extra crazy. There's a lot of craziness in academia today, but trans is just like the highest tier of crazy. Yeah. And I always think of, and I apologize to George Orwell now, I'm going to butcher his quote, but what's Orwell's famous quote where it's an idea so stupid only an academic could believe it, or something like that. Yeah. And there is your problem. I think that's why universities are particularly susceptible to this, is because intelligence is no guard against stupidity, bad ideas. Yeah. The more intelligent you are, the more likely you are to use that intellect to believe something that is blatantly absurd. And we see this with trans activism all the time. We see this in academia on the trans issue, is very intelligent people who really ought to know better are pushing the very idea that sex is a spectrum, or that, okay, if boiling it down, if you want men to be women, if you want a society in which men can be women, you simply have to destroy the concept of women. You have to destroy the definition of women. Yeah. And therefore you're going to have to go after female, because a woman is an adult human female. It's the most basic fact of human existence. Yeah. And so the linguistic contortions that they go through, the mental gymnastics in order to make these men women, it's kind of hilarious, but the real world harm is not. Yes. And so my example of Greta Bauer, Dr. Greta Bauer, who is...
And this is at Western, this person at Western.
Yeah, she's a very, very prominent...
And what is her, what is her expertise area? Do you know what she has a degree in, or what
I was thinking it was epidemiology. She's a very prominent WPATH researcher. She's very prominent in the field of gender medicine, but I think it might be epidemiology is her specialty. Okay. And I listened to this woman testify for hours in the hearing of the British Columbia nurse, Amy Ham, who was on trial for knowing that women are female. Crazy stuff. And Greta Bauer, she's clearly not a stupid woman. She's clearly very intelligent, multiple PhDs. And she's applying that intellect to convincing a panel that men can be women. And the way she was doing it was to suggest exactly that, multidimensional. Sex is multidimensional. And she was saying, hormonal sex. She basically fabricated this new type of sex, which is your hormonal sex.
And what is that? So how does that look? Like, if you're going to say a person who you would typically, who's according to biology is a man, but they're a woman because of their hormones, what does that mean?
Well, I mean, in simplest terms, women have this amount of estrogen in their body, and the estrogen produces these secondary sex characteristics, these particular characteristics. And so if you create a category called hormonal sex, then any man who takes a whole whack of estrogen and produces secondary sex characteristics similar to women, therefore he's changed sex. He's now female. He's now of the female hormonal sex. Okay. The trouble is, of course, hormonal sex doesn't exist. There's no such thing. It's just a fabrication from these activist academics who desperately want to make a world in which men can be women. It's a danger because a PhD means something to most people. Like, if you hear that someone has 2 PhDs, you're likely to respect their opinion. You're likely to think that this is an intelligent person and they must know more than I do. And so if someone with 2 PhDs can sit in a panel and talk for hours and hours and hours about hormonal sex and different abnormalities and chromosomal makeup, the panel is going to think, well, I don't have 2 PhDs, this person does. She must know something that we don't. She must have this level of knowledge that I am too stupid to understand. And so they believe her. The trouble is, she's obviously completely untethered from reality and she's lost her mind.
Yes. And so in terms of trying to restore scientific rigor, because it seems like you have the WPATH, which was not a university organization, but you had professors who were, and we know of a case of this actually, D.A. Dirks, who is a professor at Mount Royal University, who figures in my story of criticizing trans activism. D.A. Dirks, who goes by they, them pronouns, and you have to be very careful not to call D.A. Dirks she, because that will mean you'll get a harassment complaint against you if you are a colleague at Mount Royal University. But D.A. Dirks is teaching a class using WPATH as the expertise with which to do this. So that's kind of a problem, that WPATH got this belief in its legitimacy as a scientific body, which is then used by non-scientific people to teach students about these things which are not really tethered to reality.
So, in September of 2022, the World Professional Association for Transgender Health, or WPATH, released its long-awaited 8th update to its standards of care, also known as SOC, for transgender and gender diverse people, again, colloquially then called the SOC 8. So I'm going to talk about the standards of care 8 as the SOC 8, and the World Professional Association for Transgender Health as WPATH. So WPATH is globally recognized, and it's published internationally accepted clinical guidelines for the social, medical, and surgical gender-affirming care for trans people since 1979. In their own words, WPATH is committed to ensure the highest standard of care is achieved and presented in our standards of care. In practice, the SOC guidelines are, as defined by the World Health Organization, quote, recommendations intended to assist providers, that is healthcare providers, and recipients of healthcare and other stakeholders to make informed decisions.
Biology departments in universities, like why is it not the case that why are biologists not talking about the nature of sex and its gamete, like that's what sex is. There's not a non-gamete sex definition.
No.
So we would expect them to be trying to defend their discipline and so on, but that doesn't seem to be happening.
It doesn't. I've never settled on why. I have one theory is it's too stupid for a biologist to even believe. Like, I wouldn't be surprised if a large number of people in the field of biology just think there's no way that they're saying that people can change sex. There's no way that they're saying sex is a spectrum. They can't really mean it. I know, because I was one of those people in the beginning. I'm like, they don't really mean that. Sure, they're saying it, but they can't really mean it. Yeah. And I did an event in Nashville earlier this year with Colin Wright, evolutionary biologist, and he gave a talk about sex, how sex is binary. Yeah. And for Colin, I think it's a sort of like, I can't believe I'm doing this. Yeah. And I can't believe I've spent years of my life doing this, explaining something that we understood when we lived on the African savannah. The very first humans understand the difference between male and female. Otherwise, we wouldn't be sat here discussing this stupidity today. So, on the one hand, maybe the field finds it demeaning to even talk about something so simple. And on the other hand, of course, cowardice. People don't want to weigh in because they know what will happen. I mean, Heather Heying is another one who's spoken out. Yeah. She is a brilliant woman, and she puts her time and effort into explaining that male and female exists and men and women are different. It's just all so stupid that I wonder if they don't weigh in because they find it beneath them.
Maybe, yeah. The other thing I think has something to do with it is this use of this term intersex. So we know that often this trans activism promotion and so on, it is successful because it changes the meanings of words and it uses words in a way that is very confusing to people. And I know that when you use the term intersex, it makes it sound as if you have something in between. Like you have male and female and then you have something in between. And that term is not valid for that reason. Like you have abnormalities of male and abnormalities of female. And we should have language that reflects that's the situation, not intersex, which is something third thing or some kind of middle thing and so on.
I believe even the intersex community have rejected the label intersex. I mean, it started out with hermaphrodite, that fell out of favor, then it moved to intersex to be more polite, politically correct, and then I think they rejected that label.
Yeah.
We went to disorders of sexual development, and I think they didn't like disorders, so now we're at differences of sexual development.
Yeah.
But if you don't have a third gamete, you don't have a spectrum. If there is no third gamete with a reproductive function, then you have a binary. You have two sexes, male, female. Again, even I get upset explaining it, and I'm not a biologist. I don't have a PhD in biology, and even I just think, goodness me, it's just all so absurd, so stupid.
Yeah. For me, that was befuddling, because I remember, and this is actually Meghan Murphy, that was when I first sort of figured out that there's this I was genuinely confused and thought there was something else that existed that I didn't know about. And it's that kind of confusion, I think, which creates the fertile soil in which these absurd ideas are able to take root. And it was about the athlete Caster Semenya. And we were having a panel with Meghan Murphy and Julie Ray Goldstein, who I believe you have had some interaction with.
Oh, I'm familiar with Julie.
Anyway, Julie Ray, so I thought it was all very civil, this interactions and so on.
It gets even worse. Navratilova's words are also being used to police the sex of cisgender female athletes. Caster Semenya is currently in battle with the IAAF, who are trying to force her to take testosterone-reducing medication in order to further compete.
Women like Caster Semenya, yes, I think that's her name, she's from South Africa, she has like high testosterone and so she's sort of outside the norm for women. Julie Ray Goldstein was making the argument that Caster Semenya was a woman with high testosterone. And that if we were to start getting into the kind of binary discussion, we would then be, sort of excluding women who had abnormal levels of hormones or had a normal face, looked more masculine. And so I was kind of taking this as a cue to kind of think about this out loud. And I was repeating back to Julie Ray Goldstein what I thought she was saying, he, because it is a man, if we're going to be tethered to reality here, what he was saying. And when I said Caster Semenya, a woman with high testosterone levels.
We were talking about Caster Semenya earlier, and Caster Semenya has an intersex condition. So she has internal testes and then more testosterone, as you mentioned. So I just wanted to clarify that.
Meghan Murphy said, no, Caster Semenya is not a woman. Caster Semenya has internal testes, and that's why Caster Semenya has high testosterone levels. So I did see this a little bit with myself, not really having an understanding, and so I think that the kind of language games that are being played is wreaking havoc with people's ability to think about this.
Yeah, it's very much deliberate. That's been their tactic all along, because their whole ideology has no grounding in truth, and it's completely incoherent and indefensible. So the two approaches you've got, basically no debate, ruin anyone who asks questions, or just create complete confusion so nobody really knows what's going on and everybody's befuddled. I recall the confusion when I first discovered this, because my friends were all on the left. I'm very much from the left politically, and my friends were all very woke, and they were very upset when I defended J.K. Rowling in 2019. And someone shared, now to me it's hilarious, the headline, the title of this Scientific American article is "Stop Using Phony Science to Justify Your Transphobia." And the irony, of course, is it's just full of phony science. It's just full of absolutely absurd pseudoscience. But at the time I read it, and it's written in the most complicated language you could possibly imagine. The author is a they, them, I don't know, like some trans activist. But it's in Scientific American, and at the time I thought, oh, this is a respectable publication, like the appeal to authority, I suppose. You place trust in something that has a good reputation. And it was all about intersex and brain sex and everything, and the language was as confusing and complex as possible. And the point of that article is not to educate people so that they can go out and debate and discuss things openly. It's to confuse people so they're afraid to talk about the issue. That you can clearly see that that's the point. And thankfully, it's like, okay, I'm putting that to one side. None of it really makes any sense. And then I carried on reading articles that were written meant to help me understand by people it turned out to be on the side that I found myself on.
And I wanted to ask you, because this something occurred to me, I was thinking back to my own kind of thinking about this issue. There was a CBC program, documentary that was done, and I believe it was Hannah Gardner who was and I remember watching it at the time. I think it's called Finding Aiden.
Oh.
Did you ever watch that program?
I wonder. He'll be one of those.
Because I can't find it. I cannot find it. It's not available. It must be in the CBC vault
archive
somewhere.
Yeah. I assume it's one of those mythical transgender children, a documentary about a...
It's a number of different, following the situation of a number of different people. One man who had his penis, removed, etc., and he was now having regrets about it.
Oh,
there
interesting.
Was a woman,
what year was this?
This was about 2012, 2013.
Okay, in those days you could have that conversation. Transactivism sprang into existence in 2014 and it was over. All you could do was celebrate.
Yeah. But it would be great to have the CBC, pull that out of the vault and to kind of look at how people were thinking about this issue, over 10 years ago, which I think was a bit more guarded, and people were not quite sure. And you see a little bit of the kind of doubt and that sort of thing, but I was wondering if you'd watched that.
That one I have not. I just did a piece about the mainstream media coverage of this medical scandal, or the whole transactivism, but mostly the medical scandal.
Yep.
And I watched the documentary. It was a 2011 Passionate Eye. Is that a CBC? Was that a CBC documentary? Okay, 2011 Passionate Eye. It's called Transgender Kids, and it followed 4 kids who were some of the first participants in this puberty suppression experiment. Yeah. And it was really quite well done. It really did ask the important questions, like how young is too young? Can these kids really understand the fertility loss and the medical implications? And they were really trying to understand this new type of human being and this new medical treatment. Yeah. And Egal Canada, which was once a gay rights organization, and then they added the T and went anti-gay, I suppose. Yeah. They just launched this campaign against CBC. They did an open letter. They demanded that CBC apologize and accused them of causing harm to transgender kids. And from that moment on, CBC's reporting has been only very one-sided, but not willing to tackle the issue at all. So the mainstream media is also very influential. Like yesterday I actually sent a formal complaint to the Globe and Mail. It's going to all go public because we demanded that they respond, but they published an article last week that was really like a fact-free article, just like an unbelievably atrocious piece of reporting for 2025. And it got me so upset that I wrote a very long complaint, and then I got 35 doctors to sign my complaint, and we sent it to them.
And so do we have any sense of the numbers of people who have been harmed by this ideology at this time?
Oh, in our pediatric gender clinics, it's really hard to get numbers out. Yeah. Quebec just published that massive report, the Comité des Sages, I think it was called. Yeah. On gender identity. They published a big report. We got some numbers in there, and we were talking for the surgeries. I think there were maybe 400 bilateral mastectomies performed on 18 and under. There were even 10 on under 16. Like 10, 15-year-olds in Quebec have had their healthy breasts chopped off, which is really, truly, I mean, it's all a crime, but that's truly an egregious crime. We've got lots of, there are private clinics all over, there are people paying out of pocket, so you don't get the real numbers, but we're talking many thousands, I'm sure. Alberta has given us numbers, and so has Quebec, and the rest, it's kind of in lockdown. They're not revealing anything. To me, even chopping the healthy breasts off one 16-year-old girl is a crime for which someone belongs in prison. So when we're talking thousands...
Yeah, shocking. And as well, the hormones, that's the other thing, which is it is known, and maybe I'm not an expert, you probably researched this more. I think it is just well established that if you are a woman and you're taking testosterone, you're going to have health consequences from doing that, and vice versa. It's not a safe thing to be doing.
It's not even up for debate. This is they do terrible research, but everything that we have so far shows just how catastrophic testosterone is for the female body. And we're talking teenage girls and young women as well. And the uterine atrophy, the vaginal atrophy, the increased risk of heart disease, stroke, increased risk of cancer. There's all sorts of known health effects of putting these girls on testosterone, and then because of what it does to the internal reproductive organs, they'll often end up having full hysterectomies, and as well they think they're men, so they don't want their ovaries, so they'll have full hysterectomies when they're in their early 20s, late teens, early 20s, and then we know from all the literature on women, like menopausal women, that the earlier a woman goes into menopause, the greater her risk of osteoporosis, heart disease, stroke, dementia. And that's before age 45. The risk increases significantly every year that you go into menopause before age 45. We're putting 18-year-olds into menopause, 20-year-olds into menopause, and then pumping them full of testosterone on top of the fact that we've put them into menopause.
And the other thing too, why would the pediatrics associations, all the medical elements, they're the people who have the knowledge, why are they allowing this to happen?
Well, that's WPATH, you see, and that's another thing that we have going against us is I wrote a piece about Nova Scotia, so Nova Scotia has just announced it's opening more pediatric gender clinics so that they can expand access to puberty blockers to kids in the province. And so I wrote a piece about it, criticizing that, pointing to what's going on. And Nova Scotia activists were livid, absolutely livid with me. I haven't experienced an onslaught like that in a while. But one of them, it stands out in my mind because one of them said, so all of the major American medical associations, and she's listing, the American Medical Association, Canadian Pediatric Society, the American Academy of Pediatrics, all of these medical associations say that this is evidence-based and safe, and you say that they're all wrong. And I was like, they are all wrong. All of them are actually wrong. But how can the average person understand that? How can the average person grasp the fact that every single major medical association is captured by a pseudoscientific political ideology and that they are advocating for young people to be chemically castrated and have body parts chopped off based on precisely zero evidence? How can the average person even comprehend that level of fraud and corruption and conspiracy could occur? And yet that is precisely what has occurred. And it stems from WPATH. In the WPATH is just all activists. They have medical degrees, but they're trans activists first and foremost.
So in terms of our current situation, which is, we're not sure if we've reached peak trans yet or not, but there seems to be some ability to, widen windows to try to talk about this. One thing we're going to be trying to do today is the Spectrum Street epistemology approach. Have you had some success with this yourself? Are you finding this is helping people to understand things a bit more?
I've personally, in my own personal life, I've had a lot of success in talking to people and convincing them. Even before it became my entire career, I had a lot of success. I've done the street epistemology. It wasn't on the street. It was with Peter Boghossian, but in Florida, in a barn. It was an event that we did in a barn. And I have to say that there was one individual who I did not reach at all, and I don't think it's humanly possible to reach him. He does have a non-binary child, and there is the whole thing that if your child is in this, it would feel like some kind of betrayal even to listen. And so on the one hand, I have some sympathy for him that he took part in the debate, but he could not move even a mat because that would be betraying his child. I still resent how he just didn't listen to me. He refused to accept anything I said. So there are some people who are not reachable. There was another participant in the event who's very much come to an understanding, a much deeper understanding of the issue since we did it. So I think it's a wonderful format. I just think it's the way forward is to bring people from opposing sides and have a respectful discussion, and everyone has to consider why they believe what they believe. I love the format.
I think it has, and for me it seems to be the self-censorship problem, which I think is one of the big difficulties in universities. Is I don't know what the numbers are about this issue, but it seems that there's people who just keep silent about it, and because there's a silence, this is the difficulty. If there's silence and a bunch of loud people making arguments, people assume that the loud people are that's the majority opinion and so on. So when you have the street epistemology and you go in and you start talking about these things, people watch the conversations and they say, wow, it's not exactly a consensus about this issue that exists. And so I think that seems to me, I'm not sure how far you can go in terms of the depth of the discussion. It seems to get a little bit held up in terms of, but I think in terms of the surface level, where you have, I think it's called the consensus effect. It's a known fallacy where people don't hear an oppositional view, so they think that this is the only view, and that makes them more certain that they, in fact, have the correct position.
Have you heard the one I love is Elizabeth Noel Newman's Spiral of Silence?
Okay, yeah.
And that is the people with the approved opinion in a society get louder and louder and louder, and those who don't, those who have the opposing opinion get quieter and quieter, and you get this spiral. But the majority is down here, silent at the bottom of the spiral, and at the top is just this minority of very, very loud people pushing their opinion. And in Canada, we've had a spiral of silence for a good decade on all things related to trans.
Yes.
And it's particularly damaging because it's got this medical scandal tied to it.
Yes.
And because you can't talk about the medical scandal that's happening in pediatric gender clinics because that's tied to a human rights issue, and the trans activists at the top of this spiral are just like shouting and calling everyone transphobic. You end up with everybody silent at the bottom. And so the type of event, exactly what you're saying, you take it out onto the street and you show that it's okay to talk about it. And some people don't believe that it's okay to chop the healthy breasts off a 16-year-old lesbian. And not in an epistemology kind of setting, but in my normal life, when I talk about what I do, like small talk is basically like people, one of the first questions is, what do you do? And I tell everyone, I don't hold back. And sometimes you can actually feel, you can see the relief in a normal person. They can just relax and say, I don't think that's a good idea either. I heard about that. And then they're really eager to talk about it, but in their day-to-day life, they can't say anything. I honestly think it's the silent majority. Everyone, almost everyone agrees that it's wrong to do this to young people, but nobody dare say it.
Now, like, we've been confused for many years now. We've suffered from cowardice and not able to stand up against it, but we are mobilizing now. And if we cannot get this stopped this year, then it's just going to be endless horrors that are going to be, coming down the pipe. So I do really think that people are starting to wake up about this, and if we could just get people to speak more openly about it, not be afraid, and I think that the street epistemology, that is a very, very good weapon, because you can have people talking about things in a rational way, not just yelling at one another, telling people they're stupid, but why is it that you believe the things that you do?
So just what we know about human physiology tells us without doubt that this is a harmful medical experiment. But again, we're all supposed to, not only are we supposed to not criticize it, but we're actually supposed to celebrate it. We're supposed to think that it's
the pride flag this
right, that flag that's about to be raised on Parliament Hill, that is the flag of this medical scandal.
Exactly.
So when I look at that flag, I feel horror. I think about all the missing body parts.
If we don't have a common reality, then anything goes. And I was just talking to Albert and Robin about the non-binary surgery that the Ontario Ministry of Health has had to pay for, because there's a man who wants to keep his penis but also have a vagina dug out of his insides and then have a colon inserted, and that's his truth or her truth or its truth or whomever, that he is both female and male and needs manufactured genitalia from both sexes. It's really quite shocking. But that's what you have. When you have no truth, no universal truth, and it's just whatever people believe, then you have monstrosities like the kind that we're seeing today being celebrated. Like this flag that's they're rising up, that is a symbol of unbelievable dysfunction that is being celebrated. And we need to stop this. And these politicians, they are going to be held to account for everything they've done to foment and enable this contagious. Like, listen to this. These people are just cheerleaders for something they don't even understand. We're in denial, and we need, right now, it's the end, like it's time to end this. I know there's people who have had terrible harm that is done, and this is going to be a very difficult reckoning that we're going to have to face up to. But the sooner we face up to it means the fewer in the future who are going to have to face up to it. So it is just purely irresponsible for politicians and all these kinds of people who are involved in shaping how people think about things to have this celebratory attitude to have something which is so destructive.
Absolutely. I wish we could just have a social contagion of courage. We've had a social contagion of cowardice. People are not willing to touch this, are not willing to talk about it. All we need is that trigger moment, something to trigger a wave of courage. Because I really, truly believe
12:30 today.
Exactly. Everyone's on our side. Everyone agrees with us. Every decent person in Canada knows it's wrong to chop the healthy breasts off a 16-year-old girl. Every decent person knows that.
You have mental illness, you have a mental illness, you get your body parts chopped off and you still have the mental illness. So if you ever want to really leave someone behind, then that's how you're going to do it.
For leading with courage and for showing us what it means to build a more inclusive Canada together.
Well, you can go somewhere else.
Everyone enjoy the celebration of right across the country.
You're imposing your space on everyone else. Well, you can move away. It's a free country. It is a free country. No, I'm not going anywhere else. Go ahead. It's a free country.
How are we being disruptive right now? You're the one raising. You're talking about sort of everybody sort of. You're raising your voice, sir. You're disruptive. You're the one being disruptive.
Anyway, we're here. We're just raising our objections to this monstrosity that's going on, and if people don't like it, well, they're entitled to raise their objections.
You are the rainbow. And we're not exactly being disrupted. Nobody around can hear us.
No, he's listening in on our conversation.
He's being more disruptive.
So whatever, like, it's fine. Like, this is, everyone can express their views. If people, you know, I don't agree that's hateful. I think that it's being tethered to reality is not hate. And, you know, people are suffering terrible damage because of this ideology. And the fact that we have a celebration that's going on all the time about this.
It needs to be called out, it needs to be challenged.
Because it is Canadian Parliament.
And it's inclusive.
Go ahead. So you can remember who I am.
Person I know hates that fact. Red when they see that fact. They're not distracted. What's going on?
Someone's recording me. Okay, aren't we supposed to play RuPaul or something? Mia Hughes' idea that we need a social contagion of courage is exactly what is required. To facilitate this, Widdowson and Hughes traveled to Parliament Hill to participate in a Spectrum Street epistemology session and to provide public commentary on the Progress Pride flag-raising ceremony.
But I do think that, as I said on the way in here, their days are numbered. The backlash that Carly was talking about, it's real and they're not going to stop it because they've done so much harm to so many people in society, not just children, but women, LGB, ironically. The backlash is going to continue, it's going to get stronger, and eventually we won't have this flag being raised on Parliament Hill.
Professors and students, with the help of the Society for Academic Freedom and Scholarship, can change the culture of universities by challenging the spiral of silence and insisting that contentious ideas be discussed. The intimidation surrounding trans activism has enabled the worst medical scandal in human history to be perpetrated. If we want to prevent similar catastrophes in the future, academics must fight against the destruction of our universities with everything we have, before it's too late. To support or learn more about the Society for Academic Freedom and Scholarship, visit our website, and thank you for watching.